Medical news from Nature Medicine. Clinical profile and genomic characterization of the 2026 Bundibugyo virus index case in Uganda. The recent identification of a Bundibugyo virus disease index case in Uganda highlights the ongoing threat of this high-consequence infectious disease in Eastern and Central Africa, where delayed recognition and cross-border mobility can facilitate transmission. This case is particularly significant as it underscores the importance of enhanced surveillance and diagnostic capabilities in detecting and responding to emerging infectious disease outbreaks. The patient's rapid deterioration and death from multiorgan failure serves as a stark reminder of the severity of Bundibugyo virus disease and the need for prompt and effective public health interventions. Bundibugyo virus disease has long been recognized as a significant public health concern in the region, with previous outbreaks characterized by high mortality rates and challenges in early detection and diagnosis. The nonspecific nature of early symptoms, including vomiting, diarrhea, and abdominal pain, can lead to delayed recognition and reporting, allowing transmission to occur undetected. Furthermore, the lack of robust surveillance systems and diagnostic infrastructure in some areas has hindered efforts to track and respond to outbreaks effectively. This case report addresses a critical knowledge gap by providing detailed clinical and genomic characterization of the index case, shedding light on the importance of integrated surveillance and diagnostic approaches. The case report describes a comprehensive investigation involving a male patient who was admitted to a private hospital in Kampala, Uganda, after traveling from the Democratic Republic of the Congo. The patient's clinical profile was marked by a rapid progression of symptoms, including acute kidney injury, pulmonary edema, and multi-organ failure, ultimately leading to his death. A posthumous EDTA whole blood specimen was collected and tested at the Central Emergency Response and Surveillance Laboratory, where it was found to be positive for orthoebolavirus RNA and confirmed as Bundibugyo virus by RT-qPCR. Genome sequencing achieved 99% coverage at a depth of greater than or equal to 100 times, allowing for detailed phylogenetic analysis and the identification of a distinct lineage that differed from previous variants by 216 to 227 nucleotides. The key findings of this investigation include the confirmation of Bundibugyo virus as the causative agent of the index case, with a distinct genomic lineage that is approximately equidistant from the 2007 to 2008 Butalia and 2012 Aziro variants. The sequence divergence of 1.2% highlights the ongoing evolution of the virus and the need for continued genomic surveillance to inform public health responses. The patient's clinical presentation and rapid deterioration also underscore the importance of prompt recognition and reporting of suspected cases, as well as the need for enhanced diagnostic capabilities to support early detection and transmission chain interruption. Secondary findings from this investigation include the value of integrating private sector surveillance and national specimen referral systems to enhance diagnostic optimization and public health response coordination. The use of rapid molecular genomic diagnostics was critical in confirming the diagnosis and informing the public health response, highlighting the importance of investing in diagnostic infrastructure and capacity building in the region. The clinical significance of this case lies in its implications for public health practice and guideline development, particularly in the context of emerging infectious disease outbreaks. The findings of this investigation highlight the need for enhanced surveillance, diagnostic capabilities, and rapid response mechanisms to detect and interrupt transmission chains. This may involve revising existing guidelines to incorporate more sensitive and specific diagnostic criteria, as well as strengthening collaborations between public and private sector stakeholders to support integrated surveillance and response efforts. However, the investigation is not without limitations, and the authors note that further studies are needed to fully characterize the epidemiology and transmission dynamics of Bundibugyo virus disease in the region. Additionally, the reliance on posthumous specimen collection and testing may introduce biases and limitations in the interpretation of the findings, highlighting the need for more comprehensive and prospective surveillance approaches to inform public health decision-making. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.